Am I visible, man? I'm just coming soon. Wait. Yes, I come back. So let's our target to complete. It is very essential to finish our target, man. Whenever we take decisions, first I need to complete our decision. Then I think get to another any kind of decisions. First is we have to finish our target, then we will look to another case. Okay. So is I'm going to record or not? I just wanna confirm one time. Yes, because I'm just looking in the wall there is videos to going record, and that's the fantastic thing for my decision, because when I am doing this kind of challenges, and it is very easiest for me to do my work very punctuality. So that's the great thing. I think this camera give me as a motivations for something learning, something revising, and my all syllabus like this whatever I'm studying. So it helped me and it boost my confidence. Thank you for your consistency, because your consistency it means for me consistency. That's the thing. So let's look about this thing. Actually I'm talking about I have written all the thing whatever the important thing I have written, and I just want to look about the anti-hypertensive. There is written about that. This is very important questions about anti-hypertensive drug, classify and management of anti-hypertensive. First I need to, there is many association question are there. First is anti-hypertensive, classify, management of hypertensive, emergency and urgency, describe the thiazide diuretics, mechanism of actions, combinations, therapy and hypertensive. First I need to go in the hypertensive drugs definitions. If I'm talking about the definition, so I need to focus here that anti-hypertensive drug are the drugs which lower elevated arterial blood pressures and are used in the prevention and treatment of hypertension and its complications. So actually definition is that antihypertensive drug are the drug which lower elevated arterial blood pressures. So it's this drug which actually lower elevated arterial blood pressures and are used in the prevention and treatment of hypertension. Antihypertensives are the drugs which are used in the prevention and treatment of hypertension and its complications. Classifications, and now there is also written about the classification of antihypertensive drug is, first is diuretic. First I need to talk about diuretics, then symptolytics drug, sympatholytic drugs, and calcium channel blockers, drug acting on RAS, and direct vasodilator. So these are the 5 classifications which I will basically discuss about the antihypertensive drug. Thiazides, this is the thiazide diuretics, thiazides, and thiazides there will be the come of the hydrochlorothiazide and chlorothiazide in indapamides, and loop diuretics, furosemide and K aspirin is spironolactones and espalirone. Symptolytic drug is beta blockers, alpha 1 blocker, alpha plus beta blockers. So a sympatholytic drug is atenolol, metoprolol and propanolols. Alpha 1 blocker is parazosins and alpha plus beta blocker is labitalols and crevidiol. Yes, it's recording because sometime it's to be going some issues, so that's why uh, which unable to record. So actually centrally acting is cholinidine and methyl dopa. Calcium channel blocker is dihydropyrimidine. Calcium channel blocker is dihydropyrimidine. There is amylodipines and nifedipines and non dihydropyridines and paramimbles and delta James. Drug acting on RAS. So what can be the AC inhibitor? Enalaprils, ramiprils, and lisinoprils, ARBs, losartans, and telmisartans. So I think I need to sit and then discuss something, whatever I have taken. So I think I'm not visible, man. Am I right? So okay. So I just want to confirm right now. Is I'm recording? Is I'm recording? Yes, I'm recording, man. Sometimes I'm just confused with myself. That's is I'm recording or not. Suppose right now if somebody call and then there will be the cut and all the video whatever is recording is to be stopped. So that's the main issue for me, and I forget to air mode. Firstly I will do that and then I will start. Okay, so first I need to do, because if somebody call, suppose, so my call will be cut. Yes, I have done aeroplane mode, and now there will be the no any will call be come and there will be the no any issue. Okay, so is I'm visible proper? I'm just not confirm if I'm visible or not, but suppose if camera will be not in the appropriate position, so I think it might be I will not visible. Say I think I'm visible, I'm right, because just I connecting to camera. So let's go. If the question will become again and again from the if. Okay, so calcium channel blocker is dihydropyridines, non-dihydropyridines. There is amylodipines and nifedipine. Okay, so I'm talking about dihydropyridines is the calcium channel blocker. Dihydropyridines and non-dihydropyridines, amylodipines and nifedipines and verapamils and diltiazem. There are lots of drugs. How I can remember? I don't understand that there is very less, not efficient of time. So how I will prepare? Can you give me any suggestions? Whoever looking this video, please you give me some suggestion. I can do in a less time. I can do very my best, because you know very well about when you study something, there is only you have to learn and remember. So what you will do that time? So I don't understand that, because there are many drugs, there are many things to remember. So how I will just in my mind, how I will capture all the things? It is not easiest. Non-dihydropyridines is verapamils and diltiazem, and drugs acting on RAS is AC inhibitor enalaprils. Just you look about that's how the name of the drugs is enalapril. The drugs. Whenever you're looking at drugs, you will feel that oh my goodness, what you learn and what you remember. Enalaprils, and sometimes you forget about the pronunciations. Whatever you're doing, the pronunciation of the word. So that's the main problem, that the main issue. Enalaprils drugs on RAS is AC inhibitor. Enalaprils, ramiprils, lisinopril. Just you look about that. Enalaprils, ramipril, lisinoprils, ARB losartans. ARB losartans. ARB losartans. ARB. Centrally acting cholinidins and methyl dopa. Calcium channel blocker. Calcium channel blocker is dihydropyridines, non-dihydropyridine. So in dihydropyridine, what the medicine will become? The medicine will become amlodipines and nifedipines. Amlodipine and nifedipines. Non-dihydropyridines will verapamils and deltagems. Verapamils and deltagems. Verapamil and deltagems. Okay. Drugs acting on RAS. Drug acting on RAS. ACE inhibitor, enalaprils, ramiprils, lisinoprils. ACE inhibitor, ACE inhibitor. Enalaprils, ramiprils, lisinoprils. And ARBS, losartans, telmisartans, direct renin inhibitor. This is aliskiran. Oh my god, this I don't understand what I can do. These type of drugs, there are many drugs. Direct vasodilator is hydralazine. Direct vasodilator is hydralazine. Direct vasodilator is hydralazine minoxidil, and sodium nitroprusside. Hydralaziles, minoxidil, and sodium nitroprusside. Management of hypersensitivity emergency. So what will be the, in the case of emergency, so how there will be the management? So hypertensive emergency is a severe elevation of BP associated with acute target organ damage. So there will be the chances of hypertensive encephalopathy. There will be the acute pulmonary edema, acute coronary syndrome, aortic dissections, and acute kidney injury. So actually management of hypertensive emergency, there will be the hypertensive emergency and a severe elevation of BP associated with acute target organ. Hypertensive emergency is a severe elevation of BP associated with acute target organ damage. So hypertensive encephalopathy, acute pulmonary edema, acute coronary syndrome, hypertensive encephalopathy, aortic dissection, or acute kidney injury. So let's see the management. Let's see about the management. Okay, management of hypertensive management. So hospitalize, preferably in ICU, continuous BP and clinical monitorings, establish IV access and treat the specific acute organ injury. So this is the 1, 2, 3 and 4th one is use short acting tetra tables IV antihypertensive drugs. Tetra table intravenous antihypertensive drugs used. One is drug, another is important use. What is the use of? This is labetalol. So there is commonly used in the hypertensive emergency. Nicardipines. So nicardipine, there will be the hypertensive encephalopathy. When there is someone suffering from hypertensive encephalopathy, so then we will give the nicardins and a stroke setting. Nitroprusside is severe hypertensive stenosis selected emergency, and serine is acute coronary syndrome, acute coronary system, acute pulmonary edema. So serine, there will be the givens. Serine drug used is the question. There is tell me about the management of hypertensive and emergency and urgency. Describe emergency and urgency. Given discuss. Okay, let's see. Yes, there is given about management of hypertensive urgency, and where is urgency? Yes, this is urgency. Also there is given also definition: severe elevated BP without evidence of acute target organ damage. Then we can say this is the urgency. Management of hypertensive urgency: severe elevated BP without evidence of acute target organ damage. Severe elevated BP without evidence of acute target organ damage. So here what actually there's written about management: hospitalized and continuous BP and clinical monitoring. continuous BP and clinical monitoring, establish IB access and treat the specific acute organ injury, use short-acting antiretroviral antihypertensive drugs, and actually here is isomolol for isomolol intravenous, particularly useful in acute aortic syndrome. Useful in acute aortic syndrome. Management of hypertensive urgency definition is severe elevated BP without evidence of acute target organ damage. Management. See, management, if I'm talking about this is the definition, and first this is management 2, 3, 4 and 5. Confirm BP with repeated proper measurement. Assess for symptom and target organ damage. Assess for symptom and target organ damage. Do not rapidly lower BP without intravenous drug. Do not rapidly lower BP. Do not rapidly lower BP without intravenous with intravenous drug. Restart, intensify appropriate oral antihypertensive therapy. Arrange close follow-up and gradual BP reduction over the following days. Arrange close follow-up and gradual BP reductions over following days. Important point is routine. Important point, I think there is no need to learn. First need to finish. Then there will be the in the end. If I have such more time, then I can write. Important is let's study routine rapid BP reduction with a sublingual and short-acting nifedipine is not recommended because it may cause excessive hypotension and organ hypoperfusions. And here actually written about the thiazide diuretics is the mechanism of action. Example is hydrochlorothiazide, thiazide diuretics. Mechanism of thiazide diuretics is thiazide diuretics is example hydrochlorothiazide and chlorothialidones and endopamide. Mechanism is thiazide act mainly on the early distal convoluted tubule. Inhibit sodium and chlorine co-transporter. Then there will be the decreased sodium chlorine reabsorptions. When there will be the decrease of sodium chlorine reabsorption, then there will be the increase sodium and water excretions. When there will be the decreased sodium and chlorine reabsorptions, when there is a decreased sodium and chlorine reabsorption, then there will be the increased sodium and water retention. Increase sodium and water retention, and there will be the decreased plasma volumes, and there will be the decreased cardiac output. Then fall in BP pressure. There will be the fall in BP pressure. So in this way, this is the acting. This is the working thiazide diuretics. So somebody asked you about the. Can you give me some example of thiazide diuretics? If you remember, if you learn, then they can say about the hydrochlorothiazides and chlorothalidones. Indapamides. So next go about combination therapy in hypertension. Combinations. Let's see in the questions what actually it is written here. First I need to say here, look about the thiazide diuretics, mechanism of actions. Yes, I have studied the mechanism of action, is how it's working. I told you that inhibit the sodium and chlorine co-transporter. If the inhibit the sodium and chlorine co-transporter, then what will happen? It happen that decrease sodium and chlorine reabsorption. If decrease sodium and chlorine reabsorption, then there will be the increase sodium and water excretions. When there will be the excretion more and more, so what is the plasma volume? What will be the plasma volume? Plasma volume will be decreased. So if the plasma volume will be decreased, so the cardiac output will be the less. So cardiac will be the output less. So you can look about the BP. BP will be down or below, or we can say fall. So this is the mechanism actions and combinations therapy in hypertension. Combination therapy. So how, if I'm asking you to how you will give or treat combination therapy in hypertension. If someone they have a high BP, so how will you combined therapy. How will you give the combined therapy? So is basically the combination of drug, giving the different drug, or what's kind of different therapy? Can you tell me anything else? So if you can explain, then you can easily explain apart from the syllabus or any like this. So let's see about the combinations. Therapy used in adequates. Combination therapy is used when adequate BP control is not achieved. So this therapy basically is to be done when the adequate BP control is not achieved with one drug, or when initial combination treat is appropriate. It means I given the one drug for the BP control. Suppose what I can say, the any drug, just you look about, take the thiazides, loop diuretics, any loop diuretics, or sympatholytics drugs, just like atenolol, metoprolol. So if you given any drugs, suppose individual and the BP is not down, the BP is not fall. So here actually what's the going there? There is the combinations we giving, just like rational combinations. One is rational combination. Let's see about the rational combinations. AC inhibitor and thiazide. Examples: AC inhibitor is enalaprils. So AC inhibitor enalaprils and hydrochlorothiazide. So hydrochlorothiazide is the thiazide, and complementary actions improve BP control. So there will be the complementary actions. So there will be the functions or action of these two drugs is complementary actions and improve BP control. And AC inhibitor and calcium channel blocker. So we are giving AC inhibitor and calcium channel blocker. I have told you the classifications of antihypertensive drugs is diuretic, sympatholytics, calcium channel blocker, drug acting on RAS, and direct vasodilator. So here what's given is AC inhibitor. So AC inhibitor will become drugs acting on RAS. There will become this drug AC inhibitor, and there is ARBS also come, direct renin inhibitor, calcium channel blocker. There will become the dihydropyridines, non-dihydropyridines, sympatholytic drug. There is blockers, beta blocker, alpha blockers, alpha and beta blockers. So the centrally acting thiazides and loop diuretics, aspirin. So these are the most important. So we have to remember, and it will be more helpful for us. I can say, let's see. AC inhibitor or calcium channel blocker. AC inhibitor is ramiprils. AC inhibitor ramiprils and calcium channel blockers amlodipines. Calcium channel is amlodipines. Calcium channel is amlodipines, nifedipines, dihydropyrimidines. These are the drugs. And AC inhibitor. If I'm talking about AC inhibitor and calcium channel blocker, example is ramiprils, amaloprils, effective and widely used in combinations. Calcium channel blocker and thiazide, calcium channel blockers, amlodipine and chlorothalidons. Now AC inhibitor and ARBS increase risk of hyperkalemia, hypotension, renal impairment without routine therapeutic advantage. Now let's go into the another questions. I just enter in the other questions. PAR intervals iron preparations. Enumerate indications, adverse effects, iron preparations. Enumerates use, adverse effect, iron poisonings, antidotes. First I need to go the PAR interval. What's actually the define the PAR interval? PAR interval, it defines the drug is taken by which route. PAR interval means away from intestine, like this someone who thinking away from intestine, from the intestine, like this, am I right? Nearer to intestines, So I just wanna explain you the par internal iron preparations. The commonly used par internal iron preparations are iron sucrose, ferric carboxymaltase, iron sucrose, ferric carboxymaltase, iron dextrans, ferric darose maltose, sodium ferric glucanotes. They are administered mainly by intravenous route. Iron dextran can be given intramuscular, although intravenous administrations is generally is preferred in parenteral. Indications Indications enumerate parenteral preparations and indications. Parenteral preparations. So what will you write about that? If suppose if you writing a copy about the par parenteral preparations and enumerates parenteral preparations and enumerate. Is recording? Okay. They are administered manually by IV routes. Par internal. Suppose par internal preparations. How preparations? Par internal iron preparations. First, you have to write about the drugs which you're taking. The par internal. Some par internal iron preparations. The commonly used par internal iron preparations are iron sucrose, ferric carboxymaltase, iron dextrans, ferric desmomaltase, sodium ferric glucanotes. They are administered manually by IV route iron dextrans and can be given intramuscular, although a intravenous administration is generally preferred. Indications: use of par internal iron. What is indications and use of par internal irons? So there is already given about the indications. You have to write the indications and use of par internal irons. Is given about the use of par internal? No, given, not given, but we can understand by the enumerate. So we can mention in enumerates that's indication and use of par internal irons. Par internal iron is indicated when rapidly iron replace is required or oral iron is unsuitable. Parental iron is indicated when rapid iron replacement is required or oral iron is unsuitable. Let's one more time. Parental iron is indicated when rapid iron replacement is required or oral iron is unsuitable. Iron deficiency anemia. Use of parental irons. Iron deficiency anemia when oral iron is not tolerated or ineffective. Malabsorption of irons after certain gastrointestinal disorder or surgery. Chronic kidney disease, particularly in patients receiving erythropoiesis stimulating agent. Okay. Now another is severe iron deficiency requiring relatively rapid replacement. Severe iron deficiency requiring relatively rapid replacement. Non-compliance with intolerance to oral iron therapy. Okay. Now adverse effects. I have told you the adverse effect. This is compulsory when in question there is given already that you have to mention and enumerate and like adverse effect, or it's given also indications or iron preparations. Iron preparations enumerate. So it's given the two times. I'm not understand that's why par internal iron preparations enumerate indications, adverse effect, iron preparations enumerate uses, adverse effect. Iron preparations enumerate use, adverse effect, iron poisonings. What means here is going actually in one question there is given the different combinations. Just like par internal iron preparation enumerate indications, adverse effect, iron preparations given what these iron preparation enumerate use, adverse effect. I means I just will about to go in the mental phase. the why it's giving the different cases. There is a need to remember the first thing is many drugs, then there will be the some thinking to just linking the one drugs to different cases. You can use in one place to another like this. They just correlate or associate. They want to correlate associate in the different cases. So let's discuss about the adverse effect. Common nausea, headache. I also told you that before in the video there is nausea, headache, dizziness, injection site reactions, metallic taste, and hypotensions. Yeah. So important. There is no need to important. Actually, first need to finish. Then we will discuss about the important. Okay. Now iron preparations. Let's see iron preparations. Enumerations. Okay. Ferrous salt. Ferrous salt. In ferrous salt there will be the ferrous sulfate. From the ferrous salt it will be the ferrous sulfate, ferrous fumarate, ferrous glutamate. Other preparations, okay? Carbonyl iron, iron polymaltase, and ferrous sulfate is commonly used oral iron preparations. Ferrous sulfate commonly used in oral iron preparations. Uses. And now see the uses of the oral preparations, iron preparations. Uses: treat of iron deficiency anemia. Prevention iron deficiency in patients at a increased risk. Adverse effect: mainly gastrointestinal, nausea, vomiting, epigastric discomfort, abdominal pain. There are many adverse effects you have to pay attention to yourself. Diarrhea, black or dark stool. Iron poisonings, okay? Iron poisoning in the one question, it is not finished the one question. I'm just discussing from the initial time the one question iron poisoning. Acute iron poisoning is particularly important after ingestion of large amount of iron containing tablet, especially in children. Iron poisoning, it means why is to occur? It means large number of iron intake. That's the reason. It's poisoning. Or tablet. Large amount of iron containing tablet, especially in children. Now when iron poisoning given, then there is given antidote questions. Yes, where is the questions? I just wanna look the questions. Yeah, yes, antidotes is the last one. It is going to finish. Okay. Deferozamines is a chelating agent that bind free irons to form ferrozamines, which is excreted in urine. Orally, or we can say route, is intravenous in severe acute poisonings. Intramuscular or subcutaneous routes may be used in appropriate circumstance. Now let's go to another other iron chelates and deferazones and deferrizones. Deferasirox, deferioprons. Guys, I don't know right now. I just want to take nap right now, and I think I'm not able to study right now. I just need to take a rest because I have not taken rest. Before, when I'm not recording, I usually studying other things, and right now in front of camera studying. And you will look at also my face expression about how I am about to going sleep. So I will come back soon. So stay tuned. Thank you. I just coming back soon.